What are the reasons for the low vaccination rates? That big question and more with Dr. Ted Herbosa, Medical Advisor of the National Task Force Against COVID-19. Good evening, Dr. Herbosa. Welcome again to The Big Story.
Good evening, Robbie, and thank you for having me at the Big Story.
Dr. Herbosa, any ideas? What can we do? We were doing so well with the first two shots. What is behind this hesitancy behind booster shots?
Well, I heard your feature, and I heard a person specifically say they're happy with the 2 doses, no? Because I think that's all the establishments ask for, a full vaccination card. So it's very important that people understand that the antibodies wane. For example, I myself, after my 2 doses and after several months, about 3 months, I was tested in the hospital and my antibody level, my neutralizing antibodies was only 50. And that's low. And after my booster dose, just a week ago, I had it tested and it raised up to 200 plus. So definitely, over time, the neutralizing antibodies induced by the vaccines wane, and the booster will really help protect you even longer and even better. So I think there's a misconception that the 2 doses are enough. People should understand they should get a booster, just like many other vaccines where we also give booster shots.
Yes, and a lot of people also feel that, nakakaikot naman ako, nakakagala naman ako, nakakapasok naman ako kung saan-saan. Pero nabanggit din po doon sa feature kanina, how about putting an expiration date on the VaxCert, for example? Might that work?
That might work, that might induce them, but I think what's important is to convince people that while our risks are low, there is always the possibility of these new variants coming into the country and again creating havoc like it did in January. So it's very important that we boost our immunity so that if that comes, we are protected from hospitalization and death and complications of the new variants that come in. So this is actually the time we should be getting our boosters. But apparently, because of the low alert level and the low risk, low numbers of cases, people have become overconfident and complacent. So we're convincing them. The Department of Health, the National Task Force, is trying to convince everyone to get their booster shots.
Okay, in the meantime, what happens to all of that supply in case nga mag-expire?
Well, all these vaccines have been distributed all over the country. In fact, we can't say there's really that amount that's expiring because we don't know what have been utilized and given by the different regions and local governments. So in fact, we're doing what's called a wall-to-wall inventory of what is left and their true expiry date. So we will know what is at hand. Also, we are trying to, as our vaccination administration has slowed down, some of our vaccines have been decided to be donated to our nearby neighbors like Myanmar and Papua New Guinea, who are having problems trying to get vaccines or procure vaccines. So we will give them some of the vaccines that we have so that we can help them attain a certain level of immunity.
Okay, Dr. Herbosa, maraming salamat po. That was Dr. Ted Herbosa, Medical Advisor to the National Task Force Against COVID-19.